Good morning, Emeritus Chairperson, respected Dr. Swarankar sir, Dr. Kapoor sir, Dr. Sarna sir, all the HODs of different colleges of MGUMST, different head of the departments of our college, my seniors, dignitaries, friends, and dear residents. It gives me immense pleasure to welcome you all for the first postgraduate combined round. So, what is this PGCR? Only one or two slides about this PGCR. As many of my colleagues and residents were asking me that since we have these combined clinical rounds, so why these PGCRs? So, in clinical combined rounds, we present clinical cases and we discuss the multi-specialty management of them, but in PGCRs we'll take the topics which are broad specialties, inter-specialty topics, and the topics which are related to the soft skills related with the resident's life. And we'll cover those topics one by one, and the frequency as for now, but we have been told that we'll take this PGCR every first Friday of every month. And we all know that there are many topics, there are many things which are related to the different specialties, and sometimes when we deal in medicine we think of only the medicine DD, and sometimes if we are in surgery then we think of the surgical causes of those diseases. So there is a need of multi-specialty approach and a holistic approach. So I'd like to invite Honorable Emeritus Chairperson sir to say a few words if you like to, sir. Okay, sir. So I'll start with the presentation, and I think as we go further we'll improve and will help the residents in their day-to-day life and in their clinical management of patients. So I told you that what are these PGCRs? We all have read this story of 5 men with elephant, and as an individual, in individual capacity, everyone described it as per his or her understanding. But when they combined their knowledge together, the output was different, and it was complete. Similarly, when we see patients in our own specialty, we think what we know and what we have read. So multi-specialty approach sometimes to a common problem can give you a better outcome. Most of the time our own experience is not the whole truth. So it's better to take a holistic approach. So we'll cover the PGCR, in PGCR we'll cover the topics which are spread across the specialties, with soft skill topics like work-life balance, financial management, then related to thesis writing, paper writing, how to read an article, how to interpret it, and then certain clinical topics like anemia, hypoxia, which we all are facing in day-to-day life in our different specialty. This is PGCR is basically aimed to improve the overall patient care, patient safety, and to encourage collaboration between the departments. We'll try to integrate research into clinical practice by giving the opportunity to the different speakers to talk on the clinical aspect as well as the research aspect. Will help the residents to develop presentation skills, gain experience in the leading discussions, and will try to build their professional confidence. So this is our mail ID, and we welcome all the suggestions, feedbacks, criticisms, the topics we can discuss, we can cover in PGCR. You can write to this email. So we have devised 2 Google Forms. One is for the PG residents registration with their information in that, And second is a feedback form which will place as a QR code. So we'll give the attendance to the PGs depending on their feedbacks and their registration on the QR code. So this is a strong and robust PGCR review committee covering all the stalwarts and all the significant members of our community in hospital and our teachers and our colleagues, and with the help of a strong backbone of PGCR core committee and ever helping sir, our Emeritus Chairperson sir, and very proactive Pro VC Kapoor sir will try hard to make PGCR a success. So my topic is what does a consultant expect from a resident and how to become an exceptional healing hero. So purpose of this presentation is that, as we all know, that residents are the bridge between the patient and the consultant. They are the end provider, end service providers. So we need to make them perfect. So when I was given this topic by sir, when I sat and then thought that what are the ingredients and what it takes to become a good resident. So I came across many ingredients, but I couldn't find the recipe. You know, recipe for everyone is different, but there are ingredients. I can tell you that these are the good things. These are the things what a consultant is expecting from you as a resident. But one thing I can promise you, that you will be a different person altogether after the end of these wonderful 3 years in this institute. How? You will learn clinical medicine, you will learn the art of medicine, you will learn the art of management. I can promise you management which no management institute will tell you. This is the management in the postgraduate course. We all, your seniors, your faculty, we have all gone through this phase, and we all know that we became the different person altogether in those 3 years. So what are those ingredients and what does actually a consultant expect from you is that number one is dedication and commitment. We want you to be punctual, take the responsibility of your task and demonstrate a strong work ethic. And only way to succeed in your life is commitment. The commitment to your patient, to your society, to your institute, to your nation. You are not just doing 3 years course, you are going to become a different person. The second ingredient is the willingness to learn. You are in the learning phase of your career and you should be open to the new knowledge and experiences. Seek the opportunity to expand your medical knowledge and clinical skills. Just do not read only the books. Try to understand the take-home messages, the points from your seniors, your colleagues, maybe your nursing staff. They may be able to tell you many things with their experience. From your teachers, you need to expand your knowledge. Try to attend the CMEs, seminars, conferences, not only the class, the book only. Another very important thing is the teamwork and communication skill. As we all heard that song, that साथी हाथ बढ़ाना, एक अकेला थक जाएगा, मिलकर बोझ उठाना. We all know that it's a teamwork. Starting from the consultant or from the very senior management till the GVA, the cleaning worker, we all work in a team. And the problem with one service can spoil the whole product. Patient is going to experience the whole thing, not just because the doctor क्या बोलता है, doctor क्या करके गया. And communication. Communication is very important. As we all know that communication is a two-way process. हम क्या बोलना चाह रहे हैं और patient क्या समझ रहा है. It's a two-way process. Make sure that what you want to communicate is perceived as same as you want to communicate to the patient and attendant. And communication between staff, between doctors, with the consultant, with the nursing staff should be good. And many a times we need to take the decisions. Decision making is very important in clinical part, but until unless your clinical knowledge is sound, you cannot take decisions. Make sound clinical decision based on available evidences and guidelines. Not just my teacher said this, we should do like this. But I have been taught that go to the guidelines, the recent guidelines, 2023 guidelines. What are the updates? This is the difference in medicine and any other field, that we need to go by the guidelines. Update yourself with the latest trends, because your eyes see what your mind knows. If you do not know anything, you will not be able to take that decision. In the center of everything is professionalism. We all know that our profession has an image in the society. We need to carry out ourselves in a professional way. We need to talk to the patients and attendants in very professional way, respectable way, not like those things. Yeah, no. It should be, you should wear your proper dress code. You should wear your shoes. It is very important. I have been told by my seniors during my residency, even in UG, that it is very important how you carry yourself in front of the patient. Again, the patient's confidentiality should be maintained, and you should adhere to the ethical standards. Very important, another thing is adaptability and willingness to take an initiative. You know, you have been told that this patient is of this disease and this is the management. But sometime late in the night at 2 a.m., you found that no, this is, I think this is not this what my sir has told, but this is this thing. And I need to change to the plan B. So you should learn, you should have clinical knowledge, so you can go to the plan A or plan B or plan C. Learn to adapt to the new situations and take an initiative to solve the problem to improve the patient care. Attention to the detail and accuracy is again very important. Be thorough in your assessments, documentations, and treatment plans to ensure the best outcomes for the patient. And I can tell you, documentation is the key for the better patient management and to protect you and your institute from the problems. Many a times we do our duty, but we forget to document those things. Documentation is very important. So again, time management skills, very important. Your consultant expects you to manage your time effectively, because health settings are very fast-paced and demanding. Learn to manage your time effectively. Prioritize your tasks. Today is your post-admission day, and you came to know that there are 3 ICU admissions and 10 general ward admissions. So you need to prioritize that. I need to go to the first ICU first and to deal with the serious patient. This is the common sense, and you need to develop that common sense during your 3 years PG course. And and you need to meet the deadlines also. You want that you know that your consultant is coming to the rounds at around 10 a.m. or 11 a.m. You need to complete all the work. No matter you come at 9 o'clock or 8 o'clock or 7 o'clock. You need to complete that whole thing before your consultant comes on round, because everything depends on the rounds, and then we'll send the investigation, the reports will come. So you need to meet the deadlines also. To err is human. We all make mistakes. You can also make mistakes. Don't run away from that. Accept that. Accept that. And try to correct that and learn from that. Learning from mistake is what makes you human. And you should be open to receiving the feedback and guidance for improvement.
A very good morning to respected Honorable Emeritus Chairperson Dr. Swarankar sir, Chairperson and Chancellor Dr. Swarankar sir, Vice Chancellor Dr. Kapoor sir, Vice Chancellor Dr. Sachdeva sir, Pro Vice Chancellor Dr. Kapoor sir, all the esteemed faculty members, my respected teachers and my dear colleagues. I am Dr. Medha Bharadwaj, DM resident from the Department of Neuro Anaesthesiology. Today I have been given this opportunity to talk about what it takes to be a resident. This presentation made me reflect back on my time as a PG resident during my post-graduation. What all barriers I faced, how I overcome those, and what I can do to become a better version of myself during my training as super specialization. I hope this presentation will provide an insight to all the residents to become a good resident. Starting my presentation with these lines, Medical school provides the best substantiation for Charles Darwin's theory of natural selection. For here we see in its form the survival of the fittest. Not the smartest as one should expect, but the fittest to cope with the tremendous pressures, the demands made not only on the prey but on the psyche will survive till the end of this 3 years course. So residency, it is a path of rigorous training comprising of long hours and endless challenges. Residency is a journey that holds the promise of transformation and fulfillment of a lifelong dream, which I believe every one of us had, to heal and make a difference in people's life. So when we join a medical field, as everybody knows, we are acquainted with what the qualities a good doctor should possess. As Sir has effectively enumerated all the ones, just I will not take much of time, and I will tell you that one should have empathy, one should be motivated, one should have ethical awareness, which is very important in today's scenario. He should be a good team worker, he should have intellectual curiosity so that he is able to solve cases. He should have good communication skills, capacity for sustained and intense hard work, and he should be honest and should have integrity. Now, what is expected from you as a resident? At the end of 3 years, the assessment will be divided on these bases. So this is shown by the Miller's pyramid of assessment, which has 4 components, which is knows, knows how, shows how, and does. Knows, it forms the foundation of this pyramid, and it is the building for the clinical competence. Knows how is the application of the knowledge. Shows how is when you demonstrate the clinical knowledge along with the skills into a successful clinical performance. And finally does, which is assessed by direct observation in the practical scenarios. Now when we join our residency, we are introduced with our mentors. Our mentor can be any person from a respected HOD of the department to our guide to our immediate senior. So we are working in these 3 years in a very cushioned environment where our mentors, they will pass down their skills to us. To be noted is that these skills, the mentors, they have earned through rigorous training and hard work over years of experience. Our mentor may have been in experience of 10 years or maybe 40, 30 years. So it is our best opportunity and we are blessed to learn from them. So we should extract from everyone, and this will help us to become best in our field. We should always have gratitude and respect for our seniors. Residency is a time where we learn by amalgamation. By amalgamation, I mean that we learn through combined knowledge from different branches. As very specifically said, by a combined clinical rounds, we get knowledge from different fields. For example, a simple case can be seen by a neurosurgeon, neurologist, radiologist, pathologist, endocrinologist. So you get a whole vast knowledge of different aspects from just one single case. So we should be receptive to all sources of the knowledge. During our residency, we should be prepared to embrace the unknown, because every day we will see a new set of patients, each having their unique history, ailments and expectation. In order to succeed, we should develop the ability to adapt, think on your feet and make critical decisions even at times when we are faced with uncertainty. Being a resident means walking on a fine line between empathy and objectivity. We should connect with the patients on a human level while simultaneously maintaining the clinical detachment which is necessary for making an accurate diagnosis and treatment. Therefore, during these 3 years, we should learn to balance between compassion and objectivity. A very essential part of our residency is the training of being an effective communicator. So effective communication is the key to all our procedures, whether it is explaining a complex medical condition to the patient's relative or collaborating smoothly into a multidisciplinary team, as when we are performing a cardiopulmonary resuscitation. So clear communication is the key. We should learn the 3 principles of effective communication, which are assertiveness, inquiry and empathy. By assertiveness, I mean that we should learn to share our feelings openly and tactfully. By inquiry, we should learn to ask gentle questions, probing questions to find out about patient's history, his feelings. And empathy is we should understand the feelings of the patient, the thoughts and also the needs. So during our residency, we face a lot of stress. So stress can be in the form of financial burden, or it can be long working hours. It can be that we have come out of our protected environment for the first time. We may belong to a different region. There can be language barriers. There can be a lot of problems in the hostel. So these all problems, they can lead out to burnout. Burnout may cause fatigue, and in severe cases it may cause depression. But we have to keep in mind that in these moments of weariness only, you will discover your inner strength and resilience. Through these grueling hours and exhaustion, only we will learn to enlighten our mind, and we will learn valuable lessons that will help us. Now, a very important part of this is how to deal with these burnout sessions. So we have to practice ourselves from how we can go from this red zone to this green zone. Some of the effective strategies which you can do is, you can practice self-care and mindfulness. You can nurture your mind with positive thoughts. You can develop your hobby, which can be singing, dancing, anything. You should exercise and go outdoors routinely. You should maintain a healthy diet. A very important aspect is bond with your colleagues. Your colleagues are the ones with whom you will share your triumphs, setbacks. You will support each other through challenging cases, and you will celebrate the collective achievements. They will become a source of encouragement and motivation when the going gets tough. So you should confide in your seniors whenever you are feeling low. Residency is like a crash course in developing resilience. Resilience is about bouncing back from your setbacks, learning from your mistakes, and continually pushing yourselves to become better. You will discover the depths of determination and ability to find strength even in the most trying circumstances. Medicine is an ever-evolving field, and staying up to date is non-negotiable in this field. We should remember that our learning will not stop after graduation. It's an ongoing commitment to excellence and growth. As Albert Einstein said, commit yourself to lifelong learning. The most valuable asset you will ever have is your mind and what you put into it. So journey as a resident is punctuated by moments of triumph and heartbreak. From celebrating a successful surgery or waking up of a comatose patient, to the sounds of restarting heartbeats when resuscitating a patient, when someone says that at work, take some rest now, you have worked enough. When someone says, I want to become a doctor like you. Moments like these will fuel your passion, and it will tell you that why you chose this path. And yet there will be times when despite our best efforts, we might not be able to save the patient. So in those moments, we have to learn to balance between all these sets of emotion, and we have to maintain ourselves. Residency is not just a medical thing, it is a journey of self-discovery. It will teach you your limits and push you beyond them. You will realize the power of a compassionate touch, a reassuring smile, and the impact of a well-timed word of encouragement. In the conclusion, I would like to say that being a resident doctor is more than just a career path. It's a calling to which every one of us has answered. Being a good anesthesiologist, being a good physician, being a good surgeon. It's about embracing challenges, growing as a professional, and making a lasting impact on the lives of those we serve. Through the highs and lows, the triumphs and setbacks, each day reminds us of the privilege, what it is to be entrusted with the responsibility of healing, and we should be committed to giving all we have. I would like to express my gratitude to Dr. Kapoor sir for giving me this prestigious opportunity and trusting me for this task. Dr. Avnish sir for always having my back and encouraging me. Dr. Vijay Mathur ma'am, Dr. Ravindra sir for their constant guidance and support, and lastly my department for their support and encouragement. Thank you so much.
Good morning. Good morning, Swarankar sir, senior dignitaries, Kapoor sir. So the topic that Kapoor sir had given me was what I did as a resident to become a good consultant. I wouldn't be as grandiose to think I'm a good consultant, but I will rephrase it a little bit, and I will tell you that things I wish I knew as a resident that I know now. Because we are all learning, and if I could go back in time and give myself a letter as to what I should have done, I would do things a little bit differently. So these are a little bit of experiences that I've learned working in different institutes, and I'll share some with you. So the first thing is, this is how we look at residency. The black and white is what we look at residency. When you enter residency, it's usually not in the same field that you end. You end up going to different places, It's a new environment, it's maybe a hostile environment. You don't know where to eat, you don't know where to sleep, you don't know when you're going to get sleep. So you think of residency as a burden. You think it's 3 years, I have to finish it, you count down, even I. So when I did my residency in PGCR, I was like, it's 35 months now, 30 months now, I would count them down. But when you go through it, and you're on the other side, you look through the looking glass, you realize that those 3 years were extremely unique in what they provided you. Residency is a very unique opportunity that will not come back. Those 3 years which you get will not come back. So you have to, the first thing you have to realize, and that comes slowly, it doesn't happen overnight, is that residency is not a burden, it's an opportunity. And I'll tell you why it is, because it provides you with some very, very unique situations and skills which you will not be able to pick up once the period of residency is over. So start off with something very basic. When you enter residency, the first thing that you should do, which I feel now, is you have to have a textbook knowledge. That's very fundamental. The good thing about MCH program when we had started was that you had to know a book cover to cover before you entered the MCH program. You had to finish whatever specialty book that you had to do and be thorough with that knowledge before you could even give the exam. Now I think it's a little bit different, but that gave us a unique opportunity. It meant that when you entered a clinical scenario, when you entered a learning environment, you had a basic knowledge. So I'd extend that to even PG residents and say that very soon after you enter, try to find a textbook and finish it. What's available now, I just say, is another unique opportunity that's not available 15 years ago also. So apart from the regular resources that you have in institutional library, there are some incredible online resources. I'll just tap into them for a few seconds. I'm not sure if everyone is aware, but there's Sci-Hub, which I'm sure a lot of residents know. That's where you get all of the, basically any paper that you want. That I think is common knowledge. You basically type in your DOI and you can access any scientific paper anywhere. But I don't think a lot of people know about this. This is called LibGen. So LibGen is something that I discovered in my residency. It basically means that I can access any book in the entire world. If I have a topic of interest, which is like for example transplantation, I can legitimately get my hands on every possible resource that there is on transplantation. Whether I read it or not is completely different, but I can have 30 books on transplantation in 10 minutes. So as residents, you should know that it's not your access to knowledge which is stopping you. It's what you're doing with the knowledge at hand. And I've been in this situation where someone's been in surgery and not known what to do. And I remember there was, I don't know whether it's still there, but it was a surgery page called Wiki Surgery. And I remember him, I was a first year resident at that time, of actually asking what do we do now? We can't afford to do that, not in this day and age. So you have to be ready when called upon. The other thing that I really feel now is that whenever you go to work the next day, you have to prepare the previous day. So whether it's a surgical resident going in for a case, whether it's a medical resident who's going, medicine resident who's going in for rounds or with a different case, you have to be prepared. You have to put in that 20 minutes, half an hour, 1 hour before the day ends. Because otherwise the next day, you're going to be this guy in the back, people will be talking, surgical steps will be going on, and you won't know the first thing about it. And that's knowledge wasted. So what you learn today will define what you learn tomorrow. So I urge residents to put in the preparatory work that will allow them to learn the next day. Now this is an important slide. I want to stress on this a little bit. This is a resident. He is presenting rounds. He has patient problems. He has thesis issues. When he goes to a faculty, when he goes to work, he has questions. Questions, all of them. What do I do with this patient? What is my diagnosis? What is this? And what a lot of time he expects is that he will be given the answers, which is great. I mean, that's what residency is about, isn't it? But if you go with a different approach, which is basically, these are the questions. Residency allows you to come with your set of answers that you don't need to implement, but you can basically give out, have them second guessed by your consultants. You come and say, okay, sir, this is my patient, he's come with this is what I will do. First and foremost, what it does is it gives you an opportunity to think. You're not following somebody just because someone has told you that this is how it's supposed to be done. You've come and you've said, you've analyzed the information in front of you, and you've said, this is a patient, he looks like he's acute liver failure, abdominal pain, whatever. This is what I will do. You don't do that then. You will run it by somebody up the chain of command. But you have that thought in your head. This is something that needs to be built. You can very easily be somebody who's just giving away information, saying, sir, this is the status of the patients, and blank. You will get the answer, but how are you going to learn? So for every one of these situations, whether it's on rounds, it's a patient problem, or even thesis research. I mean, you go for a thesis to your guide and you go like blank, sir, I want a thesis topic. If you go with 5% preparation, be like, sir, I want to do a thesis, this looks vaguely interesting, just tell him an area of interest. This will tell him that you are engaged. This will tell him that you're committed. This will tell him that you have at least done the minimum amount of work before coming to him. Don't go at him with a blank face, so give me a thesis topic. That's a terrible idea. So this will form the basis of how you will approach a number of things in life. So this is the beauty of residency. One, for every clinical decision, you will have somebody to guide you. There will be somebody up the chain of ladder, up the chain of command, who will help you out with clinical problems, and you can go to them and they will guide you. The other thing, the safety net, is when you make mistakes. We will all make mistakes. But residency is that safety net. It allows your consultant is there to absorb you. Everyone makes mistakes. I don't think anyone in the room has gone through residency without making mistakes. So you have that safety net. Use it. But unfortunately, this is what the resident safety net is. He does nothing. He lies. He's like, I'm comfortable. This is not what your version of a safety net should be. It's not a hammock. It's not something you're supposed to lie back and just relax. It's a fail-safe for when things go wrong. The other thing we think is residency is freedom. You're out of home. We can go out in the evenings, have a good time, for sure. But the biggest freedom that residency offers you is the ability to question. As a resident, you can ask any number of questions in any situation, in whatever capacity. It can be a very, very dumb question. I'll use this slide. There is no stupid question in residency. You can get away with anything. Because as long as you go and honestly are asking your consultant or your senior for help, they will guide you. Because know this, when you cross the door of residency and you cross to the other side to become a consultant, you can't ask those same questions. You cannot ask and say, sir, I'm not so sure about anatomy, I don't know how this fits in. You can't do that. So residency is that time when you can shamelessly ask questions to whoever and whatever and get away with it. The next thing I want to tell residents is your colleagues are not your competition. Learn to study together, because it's a massive subject that you've entered into. You will need your resident's help, you will need his intellectual capabilities, because for example, I'll tell you, in surgical residency, hernia is a massive topic. Any residents know. In transplant, there are a number of massive topics. You can't go through all of them. But if you study together, you take different parts, the cumulative sum is going to be more than the individual parts. The other part I will stress on is with your competitive exams coming in. Remember, you're not competing with the guy next to you for your MCH seat or your TM seat. You're competing with everybody else. The key to getting through those exams, and I very, very firmly believe that, is to study with somebody and study together. Now this is more during residency. Now during the course of your residency, I believe this particular skill set is extremely crucial. What do I mean when I say collate information? So during the course of your 3 years, you will be exposed to so much information, so much data, there'll be just things flying around. It is your responsibility, and if you want to be a good resident, you have to be able to streamline that information, sort it in your head, so it becomes useful. So, when I talk about in memory, of course, that's how it works. If you keep doing it again and again, it helps. I'll tell you why in a little bit as well. During your time, you will be giving seminars. You will be doing lectures, you'll be giving seminars. Those are the times where you deep dive. I'll explain what deep dive means. Normally, if I was to read a particular topic, I read the textbook and that should be by the end of my knowledge. A seminar basically expects you to speak 1 hour or 40 minutes on that. That's an opportunity for you to become a master of that particular little subject. Use that as an opportunity so that in the future, you should, rather than I'll tell you, if you're able to prove to your consultant that you're smarter than them in that little subject, you have a different level of respect. Remember that. Use that opportunity because I'm telling you, your consultant would not have read enough for 1 hour worth of knowledge. That's your chance to showcase your knowledge. Don't waste it. The other thing that I want you to guys to know is, in rounds, there is a bunch of information going around. Rounds, anything in the daily thing. What I would do and what we were taught was we would keep a very small book. Like it sounds very cliche and very old, but we'd keep a very, very small notebook in our pockets. That notebook would have to be with us every day. We would not be allowed in rounds otherwise. And I thought, what is this nonsense rule? What is this notebook? I'll use it on my phone and it's not required. But believe me, it's a habit that comes and builds up so much over time. Because every small thing, you think at the end of the day, your retention is about 5%. The average retention at the end of a day as to what has happened is 5%. I'll show that slide in a bit. So you need to make sure that you're storing and remembering as much information as is possible. What this helps, I'll tell you how it helps. So I'll give you an example of what I did so you get a little insight. So I used a combination of that. I used something called Evernote. Evernote's a little app, I'm sure students will be aware of it. It's an app that helps to collate and bring together information. So this is what my Evernote used to look like. This is during my transplantation thing. So for everything, every topic, I had managed to assimilate information. 3 years is basically spent in trying to get information together. So when the time comes, I have the information at hand. So everything, for example, this is the biliary system, so whatever article I would read, whatever I learned on rounds, everything went into one system. Because at the end of 3 years, when I want to go back at it, I will not have a memory of 3 years, but I will have this to fall back on. So I'll stress to residents once again, use your 3 years to assimilate knowledge. At the end of 2.5, when you start preparing for exams, you should have your personal library ready. Now move on to one more thing. Today's reality, I'll just read this out for people who can't. He didn't publish, so he perished. So today's reality is a little bit different. What we do is my tweet has been favorited by 3 people. That's the version of publishing that we are going for. And it's not going to help us in the long run. So you need to know that publishing is a gateway. So not only is it a gateway to academia, it's going to be your gateway when you want to try out different things. You want to go for a fellowship, you want to go abroad, you have to have publications. In the US, UK, wherever you have, you need your publications if you want to go there for a fellowship. You can, at the end of 3 years, realize I've done nothing, or you can be well prepared for it. It's also required when you become faculty and want promotion. Clinical skills will only take you so far. At the end, if you want to be known, you have to publish. One more thing I'd like to stress is, during your time, identify a mentor. It's easier said than done. You don't always get it. But a mentor is crucial in your medical career. A mentor is not only an inspiration. We look up to Kapoor sir all the time. So he is an inspiring figure. Why? Because he teaches us. He tells us exactly all his 30, 40 years of knowledge he will share with us so willingly. The mentor is going to open up career paths. He will tell you ways around things, fellowships you never knew of. He'll tell you faculty openings, where to go, how to do it. And at the end of the day, when you have problems during residency, when you have difficulties, he's also your confidant, he's also your guide. So identifying a mentor, I believe, is very crucial. Now what we teach our juniors, so when a junior comes in, he's taught you should not sleep, you must work extremely hard. This is what is expected from juniors. That's what's usually taught. This is the level of dedication we want from you. What it also means is you need to teach them. This is the pyramid I was talking about. So how much do you learn? A lecture is only 5%. At the opposite end of the spectrum is teaching another person. This is the learning pyramid. That's a 90% retention. When you teach your juniors, you will learn yourself. It seems hard, it seems difficult. You're not doing it for him. You're doing it for you. And when you have that realization, you will realize that you're remembering, your concepts are becoming clear. Your juniors are going to ask you, front up, this doesn't really make sense. What is it? You'll go back and read. So remember, teaching is the best form of learning during residency. Next thing, learn to network. Your colleagues today are going to be your referring clinicians tomorrow. If you have a strong network of people around you who know you, who know that you do good work, he's an honest guy, in 3-5 years, they will be the ones sending you patients. So treat them. You know, you heard the networking term all the time in an MBA. A medical college is also used for networking. You have to be able to talk to your peers, connect with them during this time. And my last slide. Every resident will make mistakes. We will all do it. Whether it's omission or commission, we will make mistakes. How you deal with those mistakes will define you as a clinician and a person. You make mistakes, if you're upfront and you go and own it, you tell that this is the mistake I made, you'll get a telling off, sure. But you will still have the respect and the integrity that your mentors will look at you with. If you lie, it may be some short-term goals, but remember, once a consultant thinks that a physician or a resident is not honest, that's the worst thing that can happen to a resident, because you will not be trusted. So bite the bullet if you ever make a mistake, own up to it, and then move forward. This will carry on not just in your medical field, but also who you are as a person later on in life. This is my last slide. A no uttered from the deepest conviction is better than a yes uttered merely to please or worse, to avoid trouble. So be honest, have integrity, and move it forward. Thank you, sir.
I'd like to invite Kapoor sir for his presentation.
Good morning, everyone. I think most of the things which I am going to say have already been covered, and that is why also I said that I'll skip. But just to reiterate some of the important points as to how to become a good resident. But do we want you to become just a good resident? No. As your elder, as your senior, as somebody who has more experience, may not have more knowledge, because I always feel residents have more knowledge than a consultant, but probably more experience, which probably gives a little more wisdom to us. It is our duty and responsibility that you become a good human being first. And this is what I think our Chairperson Emeritus also, whenever he addresses any audience, he emphasizes on this point, and I would like to reiterate that. Before you become a resident in a specialty, we want you to be a good doctor, because your neighbor, your relatives who do not know what neurosurgery is, what psychiatry is, and what community medicine is, they consider you as a doctor. They will call you, they will talk to you for their day-to-day problems. So never lose your MBBS teaching. I feel bad and sad when a resident who's pursuing a super specialty course has forgotten what was taught in the MBBS. That is not correct. And then, of course, we want you to be a good resident if you are in a specialty, and if you are in a super specialty like Medha, we want you to be a good fellow. This is the terminology from the US. We call them junior and senior residents. And every resident is a potential consultant. In fact, the DM and MCS students, if you were in your state medical college, you would be a consultant, because immediately after your MD or MS, probably after 1 year, you can become a lecturer or an assistant professor. So this is what I used to tell my students in SGPGI, because they were all MCS students, that each one of you is a consultant in your own right. It is only that you are here as a student, otherwise you are a consultant. And then each one of you has the potential to become a head of the department, to become a principal. When I joined my MBBS, I never knew that I will occupy this prestigious position. So every one of you has the potential to become a head of an institution also, and that is what we want you to nurture for. For a doctor, as Dr. Mukesh said, that patients, even today, although things have worsened, even today treat us as next to God. And for a student, the teachers should be like a God. So here, when you are a resident, you are a doctor for the patients, and you are a student for us, the teachers. So for each one of you, this institution is a place of worship. Have you ever seen even a top politician, or for that matter even a top gunda, going into a temple without taking off his shoes? Have you ever seen? Tell me. Never. Because religion has been ground in our mind that you cannot enter a temple wearing your shoes. Same respect we have to give to our institution. Each one of us have to treat this campus as a place of worship. In terms of your behavior, in terms of your appearance, in terms of your attitude, in terms of your interaction with anybody who's in the hospital. All these qualities have been emphasized by both Medha and Shashwat. There are 2 or 3 things. One is that you have to be safe. That is a must. Primum non nocere. Do no harm. If you don't know how to do something, don't do it. You will cause less harm to the patient than if you do it wrong. There may be an exception like cardiopulmonary resuscitation or things like that, but in general. So, as Shashwat also said, this is the time when you can say, I don't know. I don't know how to answer, or I don't know how to do, and seek for help. That is a must. Trust is also absolute. If I don't trust a resident today, it is very unlikely that I will ask him or her to do a responsible job tomorrow. So you have to win, you have to maintain the trust. Even one act of breach of trust can destroy it. So it is an absolute requirement. There are 2 things which I have mentioned which are not mandatory. Efficiency. What is efficiency? Efficiency is the amount of effort that you put in and the amount of output. Now we all know there is a resident who works only 8 hours in a day but produces good output. There is another one who is slogging 14 hours a day but the output is not good. That is what is efficiency. So we want you, we will train you to become efficient, but it is not mandatory. Sincerity, hard work, dedication, safety, integrity, honesty is a must. But you may or may not be efficient. It is desirable, but it is not mandatory. What is excellence? Excellence is that you are above your peers, your contemporaries, which again, maybe, because not everybody can be excellent, and that is also what is not a must during residency. Soft skills have already been touched, but communication is very important, and the best way to communicate is a written communication. Oral communications always have problems, especially in regard to drug names, drug dosages, instructions like telling the nurse, take this patient to endoscopy. Now this patient means what? Take bed number 5 to endoscopy. In the meantime, by the time the patient is sent for endoscopy, the beds have been changed for some administrative reason, and the patient who was on bed number 8 earlier is now on bed number 5, and this has happened even in a premier institution like SGPGI in my own ward, that day 1 post-operative patient was sent to endoscopy, whereas a pre-operative patient was to be sent. So written communication is the best way, and communication of course is a separate topic in itself, which I think Dr. Mukesh has identified as one of the topics which we will address with you. Emotional intelligence is also very important in these days, especially for various social and technology reasons. We are all becoming more and more introverts, even in the same household, parents and children, siblings, they are not verbally talking. They are talking on WhatsApp, chat or whatever, but they are not verbally talking to each other. And same is happening in a class, in a group, in a society. So emotional well-being and your self-care is very, very important, and Shashwat highlighted all these aspects. So mingle with people, mix with people, make friends, not WhatsApp friends, make real friends to whom you can talk to and to whom you can relate your problems. I'm sure nobody would go to a swimming pool in a suit and tie. So same holds true for coming to the hospital also. And how you dress, how you behave, how you appear in front of the patients, who still 99% patients still consider us as gods. It is only 1% which may have kind of suspicion on us. I still feel that our profession is still the best, the most respected profession. In no other profession, a 90-year-old gentleman would come and touch your feet when you are only 25. In no other profession it would happen. They may do it to a policeman or a lawyer, but that is out of fear, not out of respect. In no other profession, a young lady will send you a rakhi who doesn't know you. In no other profession, a person will send you a greeting card on his birthday because he is living because of you. At the same time, as Shashwat said, that you are a student, you are a trainee, you are here to learn, you are here to earn those 3 letters of qualification. But during residency, more than didactic, it is self-directed learning. You have to read, you have to ask, you have to discuss. I still remember that our evening rounds were conducted by our immediate seniors. In AIMS, we used to have a 6-month semester. Our seniors who were 6 months senior to us, in MBBS we were batchmates, but they got into PG earlier. And that is how we learned, not only the consultants round in the morning, but the residents round in the evening. So please teach your immediate younger colleagues, and that will be the best learning that you will do, as Shashwat said, for yourself. And of course, if you are in a department where procedure is involved, or for example, tomorrow you are going to assist in a procedure, be it endoscopy, be it dialysis, be whatever, read before going there. And then when you have come back, read again. You will find 10 more new things which you have learned after the procedure reading. And every patient is a learning opportunity. If a patient is admitted today, go and read about it. If the same patient, same disease, another patient is admitted tomorrow, read again. No 2 patients are same. The same patient, the 2 patients coming with same diagnosis will tell you or teach you different things, and this is what we see in the CCRs also. This Shashwat has already covered. Just a practical point, that all of you have to present cases. But you have to understand that case presentation at different forums has a different meaning, has a different structure, has a different purpose. When you are sitting in the OPD with Dr. Mukesh Sarna, there are 20 patients, new patients you have to work up. So you work up a patient, but you present to him in 5 minutes so that he can guide you as to what investigations are to be done, what treatment is to be started. When you are making a presentation in the ward when the patient has been admitted, this is the first presentation. Make a detailed presentation so that everybody in the unit knows what this patient has. The next day presentation would be different, because now first day you have presented the details. Now you present what investigation reports have come, how the patient has progressed since yesterday, or what was the opinion of consultation from another department. So each day, the same patient, the presentation is different, because the purpose is different, the intent is different. In surgical practice, pre-operative preparation, the patient who's posted for today, what is important now at this stage, how long the patient has been suffering may not be of importance, but whether the tumor is involving a structure is important. So that is the pre-operative preparation. Similarly, post-operative preparation. And I always give this example. So many times I am watching a movie, but I want to know about the patient who's been operated. Now, if you start telling me details about this patient, I'll miss the important scene of the movie. You just have to tell me, sir, the patient is doing fine, the brain is showing blood, there is hemodynamic instability, so you have to know how to present. And when I go abroad, I always ask my residents to keep sending me regular emails and now WhatsApp messages as to what is happening in the ward. So there is no need that you tell me about all the 30 patients. You have to know which patients I am interested in, which are the patients who have an unexpected goal. So what I am trying to tell that depending on the time, the nature and the occasion, the same presentation will take a different shape, and that is what you have to learn. Communication was already, and this is, I picked up this cartoon because I thought it will interest you. So the girl is asking the boy, what is your idea of a perfect date? And this is what he says. So communication, the same thing said to one person may have a different meaning as opposed to same thing said to another person. And many a time I hear residents and sometimes unfortunately even consultants talking to patients or relatives in technical terms. Now, if I have also done that mistake when I was a young consultant, I was very fond of doing a particular procedure, so I kept telling the patient, "He stent डाल देंगे या biliary bypass कर देंगे." Now the patient doesn't know what a stent is or what a biliary bypass is. But now I have realized that I should have and could have talked to the patient in more layperson's terms. Respect. Show respect to everyone. You have to show respect to your patient. Most patients will tell you a story. When you take the history, they will tell you a story. Please don't say this. Listen to them. Even if you don't have time, listen to them. Very diplomatically, very gently interrupt them and ask them direct questions. Most patients are less educated, less intelligent than you. But respect their educational status, respect their socio-economic status. Don't use derogatory words against the patient or the relatives. Also, we need to respect our peers. If I don't respect you, do I expect you to respect me? So don't say things about your peers. And this was my standing instruction in my department in SGPGI. We frequently had patients coming with a complication of cholecystectomy called bile duct injury, but it was a standing instruction that no faculty member, no resident will say anything about the surgeon who has done that operation in front of the patient and relatives. We may discuss anything amongst us that he did this mistake, he should not have done this, but not in front of the patients. And some of the sentences I am sure you have read. Consent again is a separate topic in itself, so we will cover it in a separate presentation. Also, it is very easy that I show respect to those who are above me, but it is very difficult to show respect to those who are below me. And I am sure you all have seen this movie, Munna Bhai MBBS. What difference it makes, although he was a fake doctor there. I don't want you to be a fake doctor, but every person can give you a message. Every role, every actor can give you a message. Please respect. Don't shout down upon your subordinates, starting from nurses, OT staff, the guards, the GTFM workers, or anybody. Show respect to them. It is very difficult to show respect to people who are not at your level. So finally, I would say that your aptitude for a subject, for a specialty gets you in. Of course, these days it is the NEET rank also. It is hard work. It is undiplomatic today to say that, but I used to tell, and my boss used to tell us, that residency is like bonded labor. There are no working hours and there are no fixed wages. You have to work 25 hours a day. And as Shashwat said, these 3 are very precious years. So spend them very, very judiciously. And have passion. Passion means what he said in the last slide, love what you are doing. If you don't love what you are doing, you will be suboptimal in your achievements. And then you need to be committed. You need to have attitude, a positive attitude, and you should have pride in your work. Even if you are not the best, feel proud of yourself, and this is what Srishti, or I don't know whether she's here, she always says in her lectures on that you are the best. Again, work-life balance we will touch in another presentation. So with that, I would end. This is a book which is mainly for surgical residents, but there are a few introductory chapters. Have we had an attendance marked? If not, then please send me a mail, bkkapoor.india@gmail.com. Write pearls in the subject of the mail. So all the mails which I receive by tomorrow midnight, I will send you the introductory chapters which tell you some of these general things, also tell you how to present a case, how to answer questions in a clinical exam, and a few other tips which would be applicable to any clinical resident. So with that, before I invite Chairperson Emeritus, I would like to repeat what I said when I joined this institution and in a meeting with the heads of the departments a few days ago, that I consider this institution as my tapobhumi, the place of dedication, because my place of birth was All India Institute of Medical Sciences, which was my Janmabhumi. Then my Karm Bhumi, where I did most of the work, which has given me what I am today, was SCPGI. And I think today is the first ahuti in the yak of my tapobhumi, because I could not have imagined for a better occasion when Chairperson Emeritus with an esteemed guest, the Chairperson, Vice Chancellor, former Pro Vice Chancellor, Principal Ma'am, Medical Superintendent, and principals of some colleges, so many heads of the departments, faculty colleagues, and most importantly, all of you, the young boys and girls, the residents are here for this first PGCR. I can assure you that the team headed by Dr. Mukesh will make these sessions very, very useful to you. Not only from the point of view of your clinical training, your passing the exam, but for future to make you a good doctor, a good specialist, a good human being, a good citizen of the country and of the world. And please do make sure to give them suggestions, feedbacks as to what topics you would like to cover. The team has already enlisted a large number of topics. We will prioritize them, and we will keep communicating with them through the WhatsApp group about the future activities of the PGCR. Thank you.
Good morning, friends, and well begun is half done. So I congratulate Dr. B.K. Kapoor and his team on the start of this postgraduate combined round. And I am happy to see the attendance also, and I hope it will continue because this is your program for residents and by residents. साइंटिफिकली काफ़ी कुछ डॉक्टर सरना ने, डॉक्टर शाश्वत ने, डॉक्टर मेधा ने, डॉक्टर कपूर साहब ने समराइज किया। ये सब एस्पेक्ट्स ठीक है, और जो हमारे रूट्स में जो चले गए हैं, सनातन संस्कृति में जो चले गए हैं, यदि उनको मेडिकल में भी फॉलो कर लिया जाए, किसी भी फील्ड में फॉलो कर लिया जाए, तो काफ़ी कुछ प्रॉब्लम्स हो गए। इसके लिए मैं सिर्फ दो उदाहरण दूंगा। जैसे बोला कि भाई आप कॉम्पिटेंट नहीं हो, फर्स्ट डू नो हाउ, मतलब अगर आप नहीं कर सकते तो मत करो, या सीक दी हेल्प। आप अपने किसी दूसरे कंसल्टेंट को बुलाइए, अपने सीनियर को बुलाइए, गेटिंग और if you are not able to do that or somebody is not available, then what should you do? Then remember that God is there to help you if you are following the honest paths. धीरज धर्म वित्त और नारी आपातकाल पर किए चले। धैर्य की, सपोज आप एक सर्जरी कर रहे हो और इस समय फॉर एग्जाम्पल पोस्टमार्टम हैमरेज है, ब्लीडिंग कंट्रोल नहीं हो रही है, आपने पैक लगा दिया, थोड़ा पेशेंस, धैर्य रखिए। और जो चिकित्सा का जो धर्म है, धर्म का मतलब किसी रिलीजन से नहीं, जो आपका कर्म है, यदि आप जानते हो कि इंटरनल इलाज लाइगेशन कैसे किया जाता है, या इमरजेंसी सिजेरियन स्टेक्टमी कैसे की जाती है, इमरजेंसी स्टेक्टमी कैसे की जाती है, सब कुछ आप उस पेशेंट को बचा सकते हैं। और यदि आपने ही अपना पेशेंस खो दिया तो फिर क्या होगा? इसलिए हमेशा इफ यू आर हैविंग द पेशेंस, इफ यू आर हैविंग द कॉन्फिडेंस इन योरसेल्फ, देन इट इज ऑलराइट। एंड रिमेंबर गॉड, बाई चांस कोई नहीं मिलता है, हमेशा अगर आपकी उसमें आस्था है तो वो जरूर आता है। द्रौपदी को बचाया, सब जानते हैं, एक प्रकार में गजेंद्र हाथी जिसको मगर खींच के ले जा रहा था, उसको बचाया। हर व्यापक सर्वत्र समाना प्रेम से प्रकट होए में, ईश्वर सब जगह निवास करते, वो आपकी हेल्प करने के लिए तुरंत आ जाएंगे। कुछ ना कुछ ऐसा जरूर घटेगा, 5 मिनट को आपने स्वाब लगा दिया या कोई इमीडिएटली कहीं से हेल्प आ जाएगी तो वो आपको बचा ले जाएगी। आपके इंटेंशंस बहुत अच्छे होने चाहिए, ये मैं आपसे कहना चाहूँगा। आज हमारे बीच में बाकी सब कुछ काफ़ी कुछ कवर किया है और आने वाले दिनों में टॉपिक्स वाइज इस चीज़ को करेंगे और यूजी राउंड्स भी चालू कर रहे हैं हर कॉलेज में, डेंटल कॉलेज में, फिजियोथेरेपी कॉलेज में, नर्सिंग कॉलेज में, सब जगह इस तरह के मंथली राउंड्स होंगे। आज हमारे बीच में ऑनरेबल वाइस चांसलर डिजिग्नेट जो 21 सितंबर को रिज्यूम करेंगे अपना चार्ज, डॉक्टर अचल गुलाटी जी बैठे हुए हैं। तो डॉक्टर विकास जी ऑनरेबल चांसलर एंड चेयरपर्सन है, उनसे रिक्वेस्ट करूंगा कि आके सर को इंट्रोड्यूस करें।
Thank you, our Chairperson Emeritus Dr. Swarankar. At the outset, let me congratulate the PGCR team that is convened by Dr. Mukesh Sarna for successfully organizing the first PGCR. I can see in the hall there is literally no space for more people to sit. So I think second venue has to be a bigger venue. आप RK ब्लॉक का लेक्चर थिएटर ले सकते हैं, पॉलिट होते हैं, and with this popularity you might have PGs coming from other colleges to attend this once a month event. I have a vision for this program and make it grow to that level. Congratulations. We are very fortunate and very lucky to have amongst us Dr. Achal Gulati, as our Chairperson Emeritus said. He would be joining the university as the Vice Chancellor come President on 21st of September. Sir has been the principal of Maulana Azad Medical College. He has been the director of GB Pant Hospital. He has established BSA, Baba Saheb Ambedkar Hospital in Delhi, Medical College and Hospital from scratch. Sir has been the president of MARB, Medical Assessment and Rating Board of the National Medical Commission, New Delhi. With this wonderful credentials to his name, and he has been a professor of excellence in ENT for almost 15 years, senior professors for more than 10 years before that, and a lot of academic credentials to his Additional Secretary Government of India in medical education. So sir, we are really lucky, fortunate, and this is purely by the grace of God that you have consented to be the Vice Chancellor of this university. I am sure the experience you bring with you will immensely help in the development of this institute and make it into an institute of excellence. So on behalf of the students, on behalf of my residents, on behalf of the faculty, on behalf of the Board of Management, and personally on behalf of my family, I thank you for this wonderful gesture. Lastly, I would just sum up in a minute. Everything wonderful was said in this CCR. Beautiful presentation, a very pictorial and a very lasting presentation by Dr. Shashwat, Dr. Medha, Vice Chancellor Dr. Kapoor. If I have to sum it up in one line, I would say, be the kindest person. kindest person is often the smartest and is less likely to make mistakes. There's a small caveat. Make sure your safety net is intact. Safety net from medical legal issues, your own personal physical safety at work, and safety from professional subrogation. These all scenarios would constitute less than 1% of the total work time you spend in your hospital or in your career. But apart from that, 99% of the occasions, make sure you are the kindest of the lot. Everything else will fall into place. Thank you. I would request Dr. Achal to say a few words, please.
भुवन सर, सुदीप सर, मेरे सभी सीनियर्स यहाँ पे, मेरी इच्छाएं हस्तिनापुर के साथ, मेरा हस्तिनापुर बदल रहा है बस. I had never thought in the last 65 years of my life that I will be shifting to Jaipur and staying over here. Shashwat in his lecture said, a resident comes and he is very tense. मैं कहाँ जा रहा हूँ, मुझे कहाँ रहूँगा, कहाँ खाना खाऊँगा, क्या करूँगा, मेरे कौन दोस्त होंगे. So I come here in front of you as a resident. कुछ मेरे दोस्त हैं, कुछ मेरे मित्र हैं. लेकिन I come before you as a resident to learn. Every day of my life has passed learning from everybody. ENT सीखी थी मैंने 1980, 81, 82 PGI चंडीगढ़ में. पिछले 10 साल में ENT मुझे GFR याद आ गया और मुझे एडमिनिस्ट्रेशन याद आ गया. और अब मुझे मोहन सर ने कहा कि तुम देखो और क्या कर सकते हो, तो मरता क्या न करता. I am here in front of you with requiring each and every minute of support from all of you. सुधीर सर, आपसे मुझे बहुत कुछ सीखना है और मैं आपकी छाया में यहाँ पे रहूँगा, क्योंकि मुझे कोई ज्ञान नहीं है वाइस चांसलर. But at the end of the day, I think each one of you is there to guide me, and I am here for all. Thank you so much. I'll hear any questions all of you.
So, in the last, I would like to thank everyone and welcome sir to this prestigious issue. And I thank Emeritus Chairperson of this university, Dr. Chancellor sir, Principal Ma'am. And in the last, me and my team is really want to thank Dr. Kapoor sir, as he was always available during the preparation of this first PGCR time. And within no time, like within 30 seconds or 1 minute or 2 minutes, his replies comes with for every query. And I like to thank Dr. Kapoor sir. Thank you very much.